Hi there. Welcome back to Amaize Health as we continue the journey to amazing health. I'm Dr. Thorpe Amaize. Thank you for joining me today. This week we're talking about postpartum care. So now you've given birth and we want to make sure that you're still taken care of after you give birth to baby. The postpartum period is the first 12 weeks after delivery. It's an important time for new mom, baby, and family. The postpartum visits are just as important as the prenatal visits, as they help with your current and long-term health, both of which affects baby's health. Maternal deaths that occur during pregnancy and the first year postpartum is highest in the first 42 days after having the baby and represents 45% of the total maternal mortality or deaths. So, we need to ensure that you are evaluated during this critical time. You are being evaluated for complications from pregnancy and common postpartum medical complications. For instance, if you develop a fever, your heart is racing, you're having palpitations, you're having worsening tenderness of the abdomen or uterus, you need to be evaluated more urgently in the emergency room. DVTs or deep vein thromboses or PEs, pulmonary embolisms, which are clots in the legs or lungs, can occur and risk is much higher in the postpartum period. If you develop tightness, pain, or swelling in one leg or calf, rarely it does happen in both, or shortness of breath, coughing up blood, having a fever, dizziness, your heart is racing, these are also reasons to get urgently evaluated in the emergency room. Hypertensive disorders and gestational diabetes, which is diabetes that happens during your pregnancy and after, can affect a woman's long-term health and require specific attention and increases the risk of heart disease and diabetes in the future. Therefore, follow-up testing for gestational diabetes should be conducted and follow-up blood pressure checks should be arranged. Now, postpartum depression is typically screened for. If you are experiencing changes in mood, some of that may be typical of being a new mom or now a mom of multiple children. However, you should still discuss this with your doctor for further assessment of your symptoms. While I said that postpartum is in the first 12 weeks after delivery, many women will continue to have symptoms beyond this period. So do not be afraid to say something to your doctor if you are outside of this 12-week period. While we recommend breastfeeding, sometimes it doesn't go as smoothly as you would like. Typically, your care team can help or refer you to a lactation consultant to assist in the process. The takeaway points for this week are: postpartum appointments evaluate complications from pregnancy and common postpartum medical complications. Gestational conditions can affect your long-term health and requires appropriate follow-up. Those gestational conditions can include, but are not limited to, diabetes, high blood pressure, and thyroid disorders. Also, postpartum depression can and may occur far beyond the 12-week postpartum period. So please do discuss this with your doctor. Come back again next week for our Q&A to discuss preconception care, maternity care, and postpartum care. To book me for a speaking engagement or to connect with us on social media such as Twitter, Facebook, and Instagram, use @Amaize Health or the website www.amaizehealth.com. Be sure to like and subscribe. Again, this is Dr. Thorpe Amaize with Amaize Health. See you next time.